Hi guys, so today's case is another one which I did absolutely ages ago, and I learned quite a lot from it, and there's things which today I'll do a little bit better, do a little bit differently. So I hope you enjoy it. Here's the before and the after photos, and you can see that on her main issue is all on the top right here. From here you can see that the alignment of the tooth is completely wrong, and that's the main reason that she's coming in. But they also look a little bit proclined from the side view, and you can see it more here. And it is particularly this tooth here which really annoyed her, and that was the main reason that she came in. And the teeth are almost on the border of the lip. We almost have a lip trap going on. In fact, we probably do, because the lower teeth are all retroclined, the upper teeth are proclined. So she's already had ortho, so we're having another go here, and hopefully we can do a better job this time. There's obviously some perio issues going on, so step one is see the hygienist, and this is the area that she doesn't like, right? There's all sorts is going on this side. This side is really not that bad, but this is what we need to address now. Okay, so before we go into the occlusal, we can see that here we've got a half unit class 2 canine relationship. Okay, and even the premolars are on top of each other, and we're half unit class 2. If this was class 1, this point here would sit right in here. Okay, we've already had a premolar removed on this side and the other side at the top, and that was done in her previous orthodontic treatment. If we jump to the other side, it's a similar kind of thing, but we're a bit more class 1 on this side. I'd prefer the canine to be tucked back a little bit more, but it's much better than it is on the right side. Looking at the lower teeth, okay, I know we've got a filling which doesn't look that great down there, but she wasn't really too interested in fixing that, and on the x-ray it looked fine. But we've got these teeth here. One, we've got the perio issue, but secondly, you can see the kind of the bony outline here. We've got the ability to tip these two forward and probably just straighten this with a fair bit of IPR. Remember, we're going to get space by expanding the buccal segments as well. So we'll just get the brace on, expand the buccal a little bit, and procline these into a much more upright position, and that should sort out the lower teeth. Okay, so from the occlusal view, you can see that we're a premolar down on both sides. Now, remember, this tooth is proclined. Okay, so the end result, I want the incisal edge to be much more in this kind of position. Okay, and we've got all this crowding around this tooth, and if we move this one forward, what's going to happen is we're going to end up with an arch form, which is probably something like this, which is going to mean all of the teeth are a little bit too proclined. And remember that both of the canines, this one and this one, are all a little bit class 2. Okay, so they're... Whoa, ignore that. It's half unit class 2 on her right, but on the left it's almost class 1, right? So yeah, my mistake. A half unit class 2 on both sides. So what other option have I got? So I thought, okay, look, what would happen if we took that one out and then shifted everything across? Okay, so if we do this, imagine this tooth is gone and we're shifting everything across. I don't want these teeth to come forward at all, okay? That's not allowed, because we're taking out a tooth to get space. This space is sacred, so we really want to keep these two as far back as possible. But we have to bring all of this anterior segment back. So first of all, the canine needs to come back, and then this tooth is going to come forward and out there, but we need the end arch form to be much more tucked in than it was before. Remember, we don't want it out here, we want it inside here. So all these teeth are going to need tipping lingually as well. Okay, so to stop these guys coming forward, what I actually did is put a little tad here. Okay, and I'll show you that in the next photo on how we did this. Okay, so you can see we're a couple of months into treatment here, and I think this is, I put the lower brace on a few months after getting the top one started. That's why you can still see all the little dots on the brackets and things like that. But I want to draw your attention to what's going on here. So I've got the tad up here, okay? That's been placed, and I don't have that much success placing TADs in this area. The bone's really soft and they get loose almost every single time. So to stop that happening this time, what I did, we've got this wire going from here and it's just, being bent like that. So this is an 18 stainless steel wire, and I've just customized it, cut it short and bent it like that. And then we've got composite blobs holding all three positions together. So my thinking was that if we link all three things, the two molars plus the TAD together, then the amount of anchorage loss that we're going to get, the unwanted movement of the teeth going that way, is going to be minimal. And you can see that we've got this power chain, we've got this button here with some power chain and a button here, power chain push. It's pulling from both sides, but because we've got this TAD, that more result is the canine is going to move back more. Okay, and if you check the same thing out from the occlusal shot, you can see I've also got power chain running from here to here. So this tooth is getting pulled that way and that way. So this means that if we just had it on the buccal, you might get more of a rotation outward, which we don't want. And if you had it just on the lingual, it's possible that you can get a bit of a rotation in the other way. So if we're pulling it from both sides, you get less of that rotation. And I think my thinking was, if we put the button a bit more on the mesial here, we're going to get a bit more of this rotation on this side than we are on that side. And you can see that the tooth could benefit from a little bit of derotation as well. Okay, but the mistake I made here was I started all the space closure on a wire which is too thin. Okay, so if I just get rid of all of these markings here, one thing you can also see is on this lingual arch wire we've got this notch here. So this canine is no longer going to be able to slide freely along this wire because we've got this in the way, and on the other side we've got this locking it here. So this distance from here to here is now fixed. So that means when we're pulling this canine that way, what's going to happen is all of these teeth are going to get dragged along with it. And that is going to increase the anchorage demand back here and here. All right. So even though we've got this TAD, look how tight things are here right now, and you'll see that we're going to get a little bit of unwanted movement of those molars coming forward. Okay, so this is probably a month or two after that, and you can see that this gap mesial to the 6 and distal to the canine has completely closed up. This doesn't look as tight as it did before, so we have had some unwanted movement of these molars coming forward, but it's not that much, so I'm not really too concerned about it. What I will show you is that to help these front teeth come back, what I've done is extended this power chain all from here all the way over to, I think it stops here, or actually on the canine there. So that just helps bring everything closer and just close the space where we need it closed. Now, do you remember I said that I shouldn't have started closing on an 18 steel wire? It's too thin. This is why. Look at the side effect here. By pulling these two teeth together on top of each other, what's happened? They've really tipped into the space more, especially this molar here. You can see I've freshly removed the TAD, but we've got this open bite left in this area. The front teeth are much more straight, they're much more upright, they're looking a lot better, but we do have this issue here. And the way I corrected this was just move up the wire and let it just do its work. So you can see later on now we're in a much thicker steel rectangular wire, and this is just really leveling off the arches. We're keeping this space closed, which is fantastic. I haven't got any power chain or anything on there. I've just kept the buttons there just in case I need it. And you can see that the gap is still there, but it's not as bad as it was there. Previously the mesial of this 6 was right up here, but it's dropped down 1 millimeter or possibly 2 millimeters, so it's looking okay. And if we jump to the end of treatment, we still have that open bite here. It's really frustrating. The patient wanted me to get the brace off as soon as possible. She was really happy with this. This will probably improve over the 6 to 9 months or something like that, just with buccal settling, but it would be nice if we could have just closed this up possibly the next phase would be use elastics to help close that up. But overall, the front teeth aren't too proclined. Everything looks good. Yeah, you know, a contact between a canine and a molar isn't ideal, but it's the best in this situation. I think if we had done this non-extraction, the front teeth would all have been far too proclined. We'd still have that lip trap, and wouldn't be a great situation. So this is a smile photo at the end, like literally fresh at the end. You can see all the pumice and everything still on the teeth there, and you can see that it sits a bit better. The lip is being more supported with the lower teeth being a bit more proclined, and it's not too far a stretch of the imagination to see the top teeth sort of just tucking in behind the top lip there. That's mainly the exciting bit. The bottom teeth are pretty boring. So here we go. This is where we started off. Got the braces on. You can see how this premolar here, this 4, is going to be pulled out a little bit, hopefully get a bit of room because of that happening, and month by month we can just see the teeth proclining nicely here. And we're kind of getting to how far forward. I know they're a bit flat and they don't look ideal, but it's a lot better than where we were, right? This tooth is sort of measly rotated a little bit, so we've got a quick leg on there just to help us, really grab hold of it and pull it forward. And you can see we're just like carrying on, and we're getting near the end of treatment. I totally agree, they are a little bit flat, but she was really happy with it. So there we go, bonded retainer, top and bottom, removable retainers as well, and she's got her brace off and she's happy. Great, so thanks for watching. I hope you found it useful. If you liked it, please hit like or give it a thumbs up, or whatever platform you're watching this on. And if you've got any questions or you'd like to see anything specific, just hit it in the comments below and I'll try and make a video on it at some point. Alright, take care, bye!